My name's Joanne Hennel. I'm a physiotherapist. I'm currently working privately and I'm due to start back in the NHS later on this month. I really wanted to be a physiotherapist because I'd never wanted to do anything else. I'd never imagined doing anything else. I grew up in a very sporting environment, so I saw physios at work all the time. And as soon as I was old enough, I wrote to my local hospital to get some work experience, and I haven't looked back from then. There was never a plan B. That was always what I wanted to do. I left physiotherapy just over 5 years ago. I left to have my family, so I have 2 children aged 4 and 6 now. I worked quite a long commute away from home, and it wasn't feasible really to continue with a good work-life balance once I'd had my children, so I decided to take some time out, raise them. My youngest has just started school and it was time for me to focus on my career again. Returning to practice with the children being so small, it was a challenge, and it took careful planning and organising childcare, but it was good for them and they were interested in me doing something else, and it taught them about healthcare and about health professionals. But it was tiring, and it did involve a lot of help from other people. But it was doable, and it helped us work out as a family, realistically, what we could manage me working long term. When I first stepped back onto the ward in the summer, it was terrifying. I don't think I slept very well the night before. And by lunchtime, I'd say, it felt like I'd never been away. It felt a bit like home. You work out that most wards generally are quite the same. The patients still need treating the same, and it was really enjoyable. Returning to practice for me has been like the missing piece of the jigsaw puzzle put back in for me. It's completed me as an all-round person, so I have my family life and I also have my professional career as well. I think if you're at home looking to return to practice, I think believe in yourself that it is possible. It feels very difficult to imagine balancing everything. I think be prepared, be proactive and plan it well, and realise your own limitations, and work to your best ability. And it's possible. It might take a long time, but it's still possible.